Emergency management, this is chapter 16 in our textbook. There are several different emergencies that can happen in a dental office. So you have the typical chipped front tooth. Most of the time it's done by someone falling off of a skateboard, tripping, ramming into something with their bike and falling into their handlebars. You have amalgams that will break, composites that will break, tooth fractures. And so a lot of this stuff, you know, we're gonna go through in the clinic, but for this, there are some things that you can kind of talk your patient through and do some preventative things. So, dental assistant's role, where's the emergency kit and who will retrieve it? So when I go through CPR with you guys and we kind of go through this, you need to know what your role is in that dental practice. Are you the one that gets the emergency kit? Is it the dentist? Is it the hygienist, the office manager? You need to know so when an emergency happens, every second counts. You have only about 6 minutes to save that person. Who will take and monitor the vital signs? When will the call for help be placed and by whom? Who will perform basic life support if needed? Who will review the medical history of the individual? So you can actually say, and we'll role play this during CPR, you know, you look at the medical history, you call 911, you start compressions, and so all of this stuff just makes it more comfortable and more ensuring to the team when you're working like that. The dental office emergency kit we talked about in chapter 15, and you have your, not only the AED, your oxygen, your blood pressure cuff, but there's also like EpiPens in there, glucose shots for diabetics. So all of this needs to be locked up in a safe spot where especially children cannot gain access to it, but also your patients that suffer from drug abuse, they don't want to be tempted. And so this needs to stay locked up, and everybody needs to know what's in it, when does it expire. There needs to be one person in charge of this. And in CPR, we'll be doing that separately, hands-on. Allergic reactions, if a patient's having an allergic reaction, this might be one of the signs and symptoms. And so you see here, this patient's having an allergic reaction and she's very swollen, retaining fluid. So these are different signs that something's going on. Anaphylactic shock, we have the EpiPens, you have to check the date on it. So for this one, it has the lot number and it expires December 2013. And so you can see, obviously, that is more than a decade expired, right? So you want to check these. I want to say they're good for about a year. Hyperventilation, dealing with the patient's anxiety prior to treatment, alleviates fear and distress and hopefully reduces the chance of hyperventilation. When you hyperventilate, you breathe deeply and quickly and are not able to take in a full breath. A loss of carbon dioxide from the blood occurs, causing an increase in blood alkalinity. So know your plan in your office if a patient starts hyperventilating. What do you give them? How do you treat it? And who's going to treat it? And there's different types of seizures. You need to be familiar with the signs of each one of them. You have your grand mal seizures, petite mal seizures, partial seizures, simple and complex. I have had a patient have a seizure in a chair as I was placing braces, and I quickly recognized what was going on. I called the doctor over. I had brackets, upper 2 to 2, and quickly took them off so he didn't aspirate on them, and then took the retractors out, and the doctor came over and we took it from there. So Just kind of assess the situation, what's going on, and, you know, how to keep the patient safe. So the tooth emergencies, this is an abscess tooth, and the tooth emergencies for this one, what could be going on here? What could happen? These are all baby teeth, but what if these were permanent teeth and you saw this? What could be the dangers of an abscess tooth? Yeah, so this could actually affect the root. If the infection is near the root, it could start to resorb the root, and then that tooth is going to get loose. It's not going to have that root stability. So whenever you see signs like this, I've had people come up to me at church and say, hey, can you take a quick look in my kid's mouth? What do you think? And sometimes I'll say, you need to call the dentist tomorrow morning. Other times it's like, no, that's normal. So recognizing these signs and not just looking at the teeth. When you get a patient in the chair, you want to look at the teeth, the gums, everything. You know, you want to assess the entire mouth. Blood clots does not form or is washed out and nerve endings over the bone are exposed. This is very painful. And so when you have a dry socket, typically it's because the patient is a smoker or they've used a straw, they've sucked out somehow the blood clot, and now everything's exposed. It's very painful. A lot of dentists will give patients antibiotics as soon as they get the extractions so that it'll help prevent infection. But again, when a patient comes in, you need to explain the signs of a dry socket so that they'll know, hey, this is what I need to do if I start feeling this way. Here's a tooth that has gotten knocked out. I did work on a patient one time that was a professional soccer player, and he had quite a few teeth knocked out. What do you tell your patient when their tooth is knocked out? You're going to have to get implants? Can you put the tooth back in? No. Yes, you can. So when a patient knocks their tooth out, you're the one that takes the phone call in your office. Immediately put that tongue sublingual. Put it under the tongue so that the saliva will keep that tooth alive. Or you can place the teeth in a carton of milk, and that'll keep it nourished until you can put that back into the socket. You do not rinse it off. Yes?
What if the root is still attached? Say it's just partial.
That tooth right there, that's the crown and the root is all together.
Say the root doesn't come out with it.
Okay, so if you just knock the crown of the tooth and the root's still up in there, it's done. It's going to have to be extracted. But for this particular patient I worked on, we put brackets on the teeth, put them back in the socket, and then attached a wire from the healthy teeth that were still intact to the ones that had just been knocked out. And once they reattached, then we were able to take the braces off. So lots of different ways that you can handle this type of situation, but the biggest thing is keep that tooth alive by placing it sublingual or in milk. And do not tell them to rinse it off. I don't even care if it has grass on it. Don't rinse it off. Just put it under your tongue and come to the dentist office. And so you have these broken prosthetics. Never tell a patient, super glue it until you can get in here. You're going to see a lot of patients fixing their dentures or their partials. You're going to be like, what is this on here? And they'll look at you and say, super glue. So let the dentist handle that conversation and clean off the super glue, and then make a plan for, we need an impression, it's going to go back to the dental lab, or we're going to have to start from scratch. Soft tissue injury, the one up there where the labial frenum is completely gone, a lot of times this happens with boys, you know, when they're like 10 and under. They're playing with something and it hits their mouth and it cuts their labial frenum. And then you have, you know, your blisters, someone bit their tongue, and so nice warm saltwater rinses helps that.